Hi, and welcome to another edition of Your Health with Dr. Christy. My name's Dr. Christy Reisinger. The question that I'm going to answer today is, how do I know when I need to go to the emergency room with my symptoms from COVID-19? There's so many people out there that want to monitor their symptoms at home, and a lot of advice that we've been giving is stay at home unless your symptoms get more severe. Well, what does that mean? How do I know that my symptoms are so severe that I should go to the emergency room? Well, I'd like to answer that today. I want to remind everyone that the vast majority of patients that have COVID-19 are going to have relatively mild symptoms. That means those patients with mild disease will have a fever and a cough. Now remember, the fever may be very mild, only 99 degrees or higher, and the cough's usually dry, meaning you're not coughing anything up. For that other 20% with more severe symptoms, those are patients that are typically greater than 65 years old and have other immunocompromising conditions like immunosuppression due to cancer therapy, chronic suppression with prednisone, high blood pressure, diabetes, lung disease like COPD or emphysema, or heart disease. They should be more mindful of their symptoms because they're more at risk for having severe disease. The two clear ways to monitor at home are with hypoxia and your respiratory rate. Let me start by explaining a little bit about what hypoxia is. Hypoxia is when you have a low oxygen saturation, meaning that there's not enough oxygen getting to the tissues in your brain and in your body in general. There's one way to check this at home with a little device. This device is called a pulse oximeter. It's available on Amazon for about 20 to 40 bucks. It's really easy to use. Now, I'm not advocating that everyone run out and get a pulse oximeter, but for those higher risk patients, I do think it might be a good idea to have. I happen to have had a pulse oximeter at my home because when my little boys were smaller, they often struggled or had croup, and I would like to check their pulse ox before deciding whether to take them to the emergency room or not. Pulse oximeters, like I said, are really easy to use. What they're doing is they're measuring the oxygen saturation in the blood. It's really kind of a neat tool. It's really easy and simple to use. You open it up, place it on your finger, and then you wait for a certain amount of time. A normal oxygen saturation is between about 95 to 100. Anything below 95%, and especially in the low 90s or upper 80s, is concerning, especially if you also have symptoms of COVID-19. Mine reads 99%. I'm nervous right now, so my pulse is really high. A pulse of about 60 to 80 is normal, and I'm not as concerned about pulse rate as I am about this pulse ox. The pulse ox, like I said, of 95 to 99% is normal. When you have COVID-19, if you're starting to see pulse oximetry numbers less than 95, and especially in the low 90s and upper 80s, that is an indication that things are not going well, and you should start to consider going to the emergency room. Another way to monitor your symptoms at home is with your respiratory rate. A normal respiratory rate for an adult is 12 to 20 respirations per minute. So if you start to see a respiratory rate of greater than 30, that's very concerning, and I would start to consider going to the emergency room. What should you do if you don't have a pulse oximeter? Well, there are some things to also look for. Bluish tint around the lips or bluish coloration of the fingertips, or if that person starts to feel really tired or they start to not make much sense. You know, hypoxia can creep up on you, and you don't tend to have straightforward symptoms besides just this reading. So it can be silent, which is why I think having a pulse oximeter at hand is a good idea for those that are at higher risk. How long after symptoms start with COVID-19 do we see patients entering the hospital? Well, based on a study of 21 patients out of Washington in the Journal of American Medical Association, published just 2 days ago, it was about 3.5 days. Another concerning find when patients enter the hospital is to have bilateral infiltrates, meaning that there's collections on the lungs that are not normal. There are lots of different infiltrates and lots of different meanings for infiltrates, but having bilateral infiltrates over about 50% of the lungs is a very concerning finding as well. You won't know about that though until the patient enters the hospital and gets an x-ray. At the end of the day, I want to continue to stress that the most important thing that we Americans can do is social distancing. 6 feet apart, staying in small groups to limit the easy transmission of coronavirus. We're trying to protect those older adults and patients with immunosuppression and chronic disease. Thanks again for joining me.